Now let's take a closer look at submental fullness in detail. An ideal submental profile is key to a more youthful look. What is the ideal profile? Let's look at this very youthful, beautiful face and the anatomical elements to consider when looking at her submental profile. There is a distinct mandibular border. You can see this sharp angle from the gonion to the mentum. A subhyoid depression right at the transition of the horizontal and vertical planes of the neck. Often, there is a visible thyroid cartilage bulge, as well as a visible border of the anterior sternocleidomastoid muscle. And it has been described in the literature that the ideal angles include a sternocleidomastoid submental angle of 90 degrees and a cervicomental angle of anywhere from 105 to 120 degrees. All of these aspects of the cervicomental angle taken together really provide that beautiful profile seen here. And that is what we want to try to achieve for our patients, to give them that more youthful look. So what is the opposite of that? Well, it's submental fullness. You can see that the angles have changed. In comparison, submental fullness is characterized by an obtuse angle greater than 120 degrees and a blunting of the cervicomental angle. You don't see that sharp definition like you did in the previous image. As well, an indistinct inferior mandibular border can be clearly visualized here on this patient. When consumers are thinking about this, they sometimes refer to this as a double chin. We know that this is a very common yet undertreated condition that detracts from a balanced, harmonious facial appearance and leads to an older and heavier look. And to date, we haven't had a non-surgical option to treat submental fullness. And this is something that patients are interested in. Submental fullness is present in a broad range of adults, including both women and men. It is influenced by several factors, including aging, genetics, and weight gain. Submental fullness can also be present in individuals who are not overweight, and it is often resistant to diet and exercise. Let's take a closer look at 3 specific causes of submental fullness. First, aging can make submental fullness more prominent. Genetics can also be a factor. A person's genetics can cause submental fullness even in people that are young or of average weight. Excess weight can also be a contributing factor to submental fullness. It can also be multifactorial due to any combination of the 3 causes mentioned here. The presentation of submental fullness varies by the distribution of the preplatysmal fat. It can be more localized, as in the picture seen on the left, or it can present more broadly and diffusely, as in the picture on the right. The severity of submental fullness also varies widely. Here is a depiction of the range of submental fullness based on a validated scale used in the Kybella clinical trials. It represents the presentation of submental fullness from none to extreme. And the impact of submental fullness on how consumers feel about themselves is apparent. David is really frustrated, even though he is in relatively good shape. Blanchard seems to have a genetic predisposition, and it makes her feel less attractive and overweight. Andy is trying to find ways to minimize the impact of aging, and he sees this specifically as a double chin when he looks in the mirror. And for Jennifer, submental fullness has had a significant impact on her self-confidence. Now let's talk about current treatment options for submental fullness. To date, treatment for submental fullness has included procedures such as neck and facelift surgery and liposuction. The characteristics of patients who may choose surgery include platysmal banding, excessive skin laxity, presence of jowls, poor skin quality, and of course those who are not averse to surgery. The characteristics of patients who may choose liposuction include good skin tone, excessive fullness, desire for immediate correction, desire for less scarring, younger patients, and older patients who are unwilling or unable to have a facelift. Patients who are candidates for liposuction but averse to surgery may be candidates for treatment with Kybella, deoxycholic acid injection. Many patients who are averse to surgery would prefer a non-surgical treatment option to contour submental fullness. Non-surgical cosmetic procedures have increased by more than 500%, compared to 82% for cosmetic surgery since 1997. And you can see the tremendous increase overall since then. Until now, there has been no FDA-approved injectable drug clinically proven to contour and improve the appearance of submental fullness. Let's discuss Kybella, deoxycholic acid injection, and the results from the Kybella clinical program. Here is an example of a patient who is treated with Kybella. This is a 35-year-old patient who is thin with a normal BMI. She presented with submental fullness. She had 4 treatments. This after photo was taken 12 weeks following the last treatment. She has a visibly improved submental contour. Kybella, deoxycholic acid injection, is the first and only FDA-approved injectable drug that contours and improves the appearance of submental fullness. When Kybella is injected into subcutaneous fat, it causes the destruction of fat cells, or adipocytes. Once destroyed, those fat cells cannot store or accumulate fat. Treatment with Kybella is customized by the physician to the patient's aesthetic goals for an improved chin profile. And once the aesthetic response is achieved, retreatment is not expected. The most commonly reported adverse reactions in the pivotal clinical trials were injection site edema swelling, hematoma bruising, pain, numbness, erythema, and induration. Kybella is indicated for improvement in the appearance of moderate to severe convexity or fullness associated with submental fat in adults. The safe and effective use of Kybella for the treatment of subcutaneous fat outside the submental region has not been established and is not recommended. We will explore these concepts in more detail. Let's continue. Kybella has been the focus of a global clinical development program involving over 20 clinical studies with more than 2,600 patients worldwide, of whom over 1,600 have been treated with Kybella. This clinical development program was conducted over more than 9 years. Here's another example of a patient who is treated with Kybella. This is a male patient. As we discussed earlier, male consumers are also aesthetic patients. This is a 34-year-old patient with normal BMI when he entered the study. He presented with relatively localized submental fullness. He had 5 treatments. This after photo was taken 12 weeks following the last treatment. He has a visibly improved submental contour.